I'm Dr. Damon Miller, your organic MD. Today we're going to be talking about a procedure from Oriental medicine to deal with acne, and it's called acne treatment with Moxa and Oatmeal. Sorry I don't have a more creative name for you because it uses Moxa and it uses oatmeal. The Moxa is in the form of a stick. Now the Moxa is used, we'll get to this in a minute, but the Moxa is used to, you burn the Moxa and you use it to heat the skin wherever you have acne. And that draws the circulation to the surface, it increases blood flow, and then once you've got the circulation really ramped up, then you're going to be taking a bag of oatmeal here that I've soaked and use that, the material that can be expressed from the oatmeal to make a mask to cover your face. So the Moxa sticks, this is the box they come in, and the Moxa, when it's new, this is a stick. These are very inexpensive. This is just pure Moxa. And the Moxa has a kind of paper, this printed part. Before you light this on fire, you'd want to peel some of this off just to get rid of it. And then you'd light the end. We're going to be using one that, just from my office here, this is the one I use during the days. And again, it looks like a cigar. It has a, this is just the old burnt end. You could use a cigar, yes. You could use a sage bundle. You could use a heat lamp. There are many ways to heat the skin. The Moxa is important because the notion of toxicity in Oriental medicine includes both physical toxins and emotional toxins. And I know it may sound a little crazy, like so many things do in Oriental medicine, but the Moxa stick actually touches the spirit. This procedure doesn't work for some reason if you use something other than Moxa to heat the skin. So to light this, we just need a lighter. We're just going to get it going here. Now the Moxa holder, this steel Moxa holder that this was sitting in, is also a critical component. It's a heavy steel thing, and when you put the Moxa stick in it after you're done with it, it extinguishes it. So it's a Moxa holder and a Moxa extinguisher. And it's very important that you have that or something as good or better, because once I get this burning, it will just burn all the way to the end and possibly take the house down with it. So you need a way to reliably put this out. So a little more flame here. They're a little hard to get going, but once they're going, they don't stop. And this, the Moxa holder, it's a pretty heavy steel thing. And when you put this in it, it just deprives it of oxygen and the heat sucks, the steel sucks the heat away. This particular one has a bit of a curved thing here, so you can rest the stick in it when you're not using it. That's handy. The ones that we have in the store have that little curved lip on it. But you can get these, if you have a Chinatown in your town, you can get these in Chinatown. And we're going to be using what's called, with the Moxa stick, what's called a pecking technique. So in the same way that a bird pecks, you're not going to just hold this next to the skin. You're just going to bring it close to the skin, and it's quite hot. Don't touch the skin. You could hold your thumb here if you wanted to make sure you didn't get it too close. But you're just heating the skin, bringing it in, pulling it away, bringing it in till it's hot, pulling it away. People worry about the smoke. They actually burn this in asthma wards in China. But the one thing about the smoke, when you burn this, it does smell a little like marijuana. In fact, it smells a lot like marijuana. But it's not. It has nothing to do with marijuana. But you might want to do this outside just so that people don't come into your house and think you've been smoking dope. If you've ever been in an Oriental medical practice before, you know the smell of it. And so just doing this, just kind of coming in, pulling it away, coming in, pulling it away, keeping the ash off, coming in, pulling it away, and just heating up the skin. Now the oatmeal bag over here I made up previously and soaked it briefly in some very hot water, just hot water from the tap. This is just a piece of muslin. This simple muslin cloth, very inexpensive also. And this is about a half cup of oatmeal. And what we're going to do is I'm going to make a pouch out of this. Now, if you're handy, you could sew this up, but I'm going to show you a quick and dirty way to do it. And this unbleached muslin, I'm just going to kind of put the oatmeal in here. And I'm going to gather up the cloth. And then I'm just going to use a rubber band on this. Just a simple rubber band. And I'm just going to And so now I have a little muslin pouch full of oatmeal. So just really getting the skin, really increasing the circulation. I'm going to put that out now. I'm just going to put that into the... That's it. You could also use a bowl of rice, or you could take a knife and cut this burning end off. Don't use water. Water will ruin the stick. It'll never be the same. But you could cut the burning end off or just stick it in a bowl of rice. But you want to make sure it's out. And then we take this muslin, and this has been soaked. And now if I squeeze this and just take the stuff that's coming out of it, it's not real noticeable, but it's very slippery, you know, like oatmeal, kind of that stuff. And I'm just expressing it, squeezing it, coming out, and then I'm just using that to make a mask. And when I'm done with this, I can take this and put this on a plate in the refrigerator, and this will be good for a number of days. You don't have to make this up each time, but you want to do this every day for about at least 7, maybe 14 days in a row. You can do it more if it seems to be working, but you need to go further with it. So it's hard to see, but I've got this nice slippery oatmeal mask on there. I'm just going to let that dry. And that absorbs and pulls out, expresses the toxins now that the circulation's been increased in the skin. And that's basically it. So once it's dried, I'll just take a damp washcloth and rinse it off, and we're done. So that's the acne treatment with Moxa and Oatmeal. This is Dr. Damon Miller. I'm your Organic MD. We have our YouTube channel. Please subscribe. We'll be having a lot more do-it-yourself medicine in the coming months. I look forward to seeing you. Thank you.